Good evening. My name is Maisha Blue, and here's my name printed on paper. Today's date is November 23rd, 2025. Today, I will be presenting my findings for the Unit 4 video presentation. And I decided to choose the two cases, Case 1 and Case 2. I also would like to take a moment to share my screen so that I could visualize my findings as well. So as we continue, I do just want to make sure we're familiar of case one. A newborn girl approached normal at birth, but within 24 hours, she developed lethargy, hypothermia, and apnea. Attending physician suspects a metabolic disorder and order a panel of labs. A full blood workup was ordered with this female and data presented below. Initial blood ammonia level was elevated with 314 and rapidly rose to 600. So as we continue, we do want to expand on the findings of glutamate dehydrogenase, glutaminase, glutamine synthetase, and the role of transamination when we are discussing ammonia transfer within the body. And in my own words, I can say that glutamate dehydrogenase can be looked at as an enzyme that's found within the liver, and it ushers ammonia in and out of amino acids. It is used to convert glutamate to an alpha ketoglutarate and ammonia. Glutaminase is an enzyme which is also found in the liver, but also the kidneys. It is used to isolate ammonia from glutamine. Glutamine synthetase is a series of enzymes that prepare ammonia for transport to the kidneys and livers. And since ammonia is something that we should consider the pH of the environment that is within and making sure we're not disrupting all the environments it comes into contact with. So that is why we are very considerate of the transamination of these amine groups carried out in the ammonia transfer process of the body. As we move on, I also want to expand on how is nitrogen transport connected to gluconeogenesis in the fasted state. Well, after fasting, a transmigration reaction occurs and it forms alanine within the bloodstream from the breakdown of muscle proteins. Muscle proteins initiate breakdown during the fasted state. While alanine is carried in the bloodstream, it flows to the liver and converted back to pyruvate and is free of the amino group. Finally, the remaining pyruvate can be used for gluconeogenesis so that we can have glucose. And as we consider further analysis of the urine orotic acid levels were marked at an elevated 473 with creatinine, and the plasma citrulline level was also at a normal at 10. So in this individual where orotic acid levels are elevated, what uricycle enzyme is most likely deficient? And as we're surrounding what should be considered for this case scenario, we can say that orthine, give me 1 second so I can pull back up these details. So in short, OTC is the most likely deficient level as it causes a buildup of carbonyl phosphate, which is a byproduct of the urea cycle. This leads to the origin of acid of pyrimidine synthesis. As we discuss this further, I can also include that in short, NAGS would be least likely to be impaired as it occurs as a first step of this process, meaning it would have least of an impact on the buildup. It is the part of the process that initiates it or the green light that tells it to start. And it's more of a rare deficiency. As we consider which amino acid becomes less essential throughout this full process, or kind of like a domino effect, We can say arginase is the enzyme that holds this role and becomes more essential. It occurs as a last step, having less of an impact on the buildup again, and is known as the deficiency of hyperargineemia. The demand for arginine would grow in the absence of OTC. And that finalizes my findings for my answers of case one. We can move further into case two. And with case two, we are discussing three different scenarios, more so with the focus on where is the enzyme deficiency, which amino acid is no longer metabolized based on the scenario, and which one becomes essential as a result of the deficiency. And the third topic for each of these scenarios is finding out which potential vitamin supplement may be useful for the condition, and what steps does it take part in metabolism. So in scenario one, we are considering a full-time girl who was born by normal vaginal delivery and was released from the hospital at 3 days of age. At 9 days of age, a screening test for branched chain amino acids came back positive, and the child was readmitted to the hospital for further evaluation. There was no history of any genetic disease in either family, and both older siblings were well. I could say that the most likely enzyme deficiency is maple syrup urine disease, which sounds interesting. But as we expand upon this further, it is when we are considering amino acids with the branched chain alpha keto acid dehydrogenase, or in short, BCKDC. And it's the complex which it is no longer metabolized. As we expand upon these findings and see how it impacts other components, the essential amino acid would be leucine, isoleucine, and valine because they all fall within the branched chain category. And potential vitamin supplements that may be useful for this condition include vitamin B1, also known as thiamine, and this would play a role of a cofactor of the BK or BCKDC enzyme to assist in our metabolism. As we move towards scenario two, we're discussing a 69-year-old woman presented with a 30-year history of lower back and large joint pain of the hips and shoulders. On examination, blue-gray pigmented macules were presented over the cartilaginous parts of her ears and the sclera. Past medical history included aortic stenosis. So as the patient is most likely suffering from acaptonuria, the most likely enzyme deficiency in this case scenario is homogenistic acid oxidase, in which homogenistic acid is no longer metabolized. This disorder is not causing any amino acid to become essential, opposed to other similar processes of this deficiency. In potential vitamin supplements that may be useful for this condition of acaptonuria is vitamin C, also known as ascorbic acid. And in the metabolism process, it will help with directly oxidizing the homogenistic acid and its proper functioning. Lastly, we will be discussing scenario three as we discuss a 4-day-old infant being followed in your clinic. Her birth weight is 5.9 pounds, and the pregnancy and birth at vaginal delivery were normal. Results from the newborn screening demonstrated phenylalanine level of 6.6 milligrams, and we are expanding upon our findings as the patient is likely to be suffering from phenylketonuria. Is most likely the enzyme deficiency of phenylalanine hydroxylase, short for PAH. This directly prevents the metabolism of phenylalanine. As a result of this deficiency, a few amino acids become essential, such as tyrosine. Tyrosine is derived from phenylalanine. Potential vitamin supplements that may be useful for this condition include biotin, and vitamin 12. These vitamins, what steps in the metabolism they could potentially help with.